functional medicine SF, we do use a team-based approach. If you are a patient of mine, we do our entire case review together. We still have other team members that are helping with additional layers or pieces of your plan. So for example, for health coaching, that's where you can go through questions you might have, logistical issues, how do you do this test, what does this mean? I'm trying to fit, my B complex into this part of my day, how do I do that? I'm traveling, how do I make sure that I'm still, keeping a low inflammation diet, but, I'll be in Ohio at my mom's house, and so on and so forth. So we have a health coaching component that helps with all of those details. And then because your plan is essentially laid out after the case review, essentially the entire, path to wellness from start to finish, despite the fact that there's refinement along the way. There are additional appointments that we call interim appointments that we use to assess where are you at, and that's part of the plan. Is there any troubleshooting? Are you having a reaction to something unexpectedly? Are we getting new information that we just need to, slightly augment or refine what your instructions are in order to make further progress? And those are also appointments that are often done by one of our team members, another clinician, either our physician's assistant or our other physician, both of whom are clinicians and can make assessments and read labs and prescribe and so on. But they're using the master plan that we've come up with from the case review as a global guideline. In addition, we do talk about patient cases together. We have case conferences. We discuss, aspects of care as a team. And I'm overseeing, if you're a patient that is case reviewed with me, I'm overseeing all of those appointments, even when I don't see you face to face. Some patients might come in as brand new patients and work with me for those first 90 minutes where I'm doing the intake. But for our lower complexity patients, our patients who might be, menopausal or seeking just hormone replacement, or specifically focused on improving their nutrition, or maybe they're focused on weight loss. One of our other clinicians, Dr. Mima Gear, is particularly skilled with all of those kinds of conditions, and those are the kind of cases that I would be passing on to her, and you wouldn't see me again. You would be working with Dr. Gear at that point.